Welcome to NSG 222 Study Session 2 Basic Concepts in Medical Surgical Nursing. Introduction. Fatigue is also one of the common symptoms everyone experiences at one point in time or another. It is a complex symptom because it affects every system of the body. Example: endocrine system, cardiovascular system, musculoskeletal system, etc. For this reason, a person who experiences fatigue requires the help of a healthcare provider. Experience of fatigue results in inability to continue with daily activities as it affects individuals' well-being. In this study session, the meaning and types of fatigue will be discussed. You would also learn about the effective nursing management strategies to help someone who is experiencing fatigue. Learning outcomes. At the end of the study, you should be able to 1. Identify and describe the types of fatigue. 2. List the clinical manifestations of fatigue. 3. Describe the nursing interventions to a client experiencing fatigue. Meaning of fatigue. Fatigue is a feeling of tiredness or exhaustion or a need to rest because of lack of energy or strength. Some of the primary causes of fatigue include 1. Overwork. 2. Impaired sleep pattern. 3. Psychological disturbance. 4. Lack of exercise. Fatigue may be secondary to illness, pathophysiological, or a side effect of treatment. Example: chemotherapy. Anxiety or depression may also lead to the experience of fatigue. It is important to understand that fatigue is not synonymous with weakness. Weakness denotes a neuromuscular problem, but fatigue is a response to processes which have adversely affected all body systems. Mechanism of fatigue. Bartley, cited in Jacobs and Gills, 1985, explained how fatigue occurs in humans. According to the author, 4 processes are involved. These are cellular impairment, systemic disorganization, discomfort, decrease in activity. 1. Cellular impairment. Here, there is decreased ability of the cells to function, which results in depletion of energy, which is in the form of oxygen, adenosine triphosphate, ATP, or glycogen. When this happens, there is accumulation of metabolic waste such as lactic acid and pyruvate. It may occur following repeated muscular contraction during physical exercise, which may result in impairment. This makes the muscle fibers to contract less effectively with delayed recovery time. This cellular impairment produces both physiological and physical changes. For example, anxiety provokes a disorganized thought process which results in palpitations and gastrointestinal disturbances such as diarrhea. 3. Discomfort. This is a subjective experience described by the individual, such as muscular ache after repeated use. It is a cognitive or sensory discomfort that makes it difficult for the individual to continue with specific activities which he or she was engaged in. The individual is thereby compelled to stop the activity. 4. Decrease in activity. The experience later becomes obvious and objective. The individual becomes less effective at work with decreased productivity and output. There is muscle weakness and the individual can no longer accomplish the same work. This affects the physical and mental activities, including the thought process. From the above explanation, we can say that fatigue is a net response to cellular impairment, systemic and psychological disorganization that produce experiences of varied discomfort in the body, which manifest in observed decreased activity. Types of fatigue. There are 4 types of fatigue as given in the picture: normal fatigue, pathophysiological fatigue, situational fatigue, psychological fatigue. 1. Situational fatigue. Situational fatigue occurs when the normal coping mechanism is depleted in crisis. The individual is not able to cope effectively using the usual mechanisms. Situational fatigue is a variant form of normal fatigue. Situations such as career change, death of a loved one, marriage crisis are examples of situations which require unusual amounts of energy and resources to cope. Failure to cope results in a feeling of helplessness, anxiety, and fatigue. 2. Normal fatigue. An expected response following exertion or an added stress as occurs following a hectic schedule or inadequate amount of sleep. Normal fatigue resolves quickly and predictably with rest and moderate modification in lifestyle. 3. Pathophysiological fatigue. This term is used when fatigue occurs as a symptom of a disease or an outcome of a disease process. Pathophysiological fatigue may precede acute febrile illnesses such as viral or bacterial infections. Patients with chronic health conditions such as chronic obstructive pulmonary disease, COPD, heart failure, nutritional disorders may experience fatigue which cannot be expected to resolve by simply taking a rest. 4. Psychological fatigue. This is said to occur when fatigue is secondary to psychological disorders such as depression or anxiety. When an individual is depressed, there is usually a loss of interest in usual activities, slowing of psychomotor responses, etc., results in disorganization and exhaustion. Psychological fatigue may take a long time to resolve. When an individual is depressed, there is usually a loss of interest in usual activities, slowing of psychomotor responses, etc. In anxiety states, more energy is utilized in the body and, if prolonged, may result in disorganization and exhaustion. Psychological fatigue may take a long time to resolve. Clinical manifestation of fatigue. Clinical manifestation of fatigue is dependent on the type of fatigue. You should explore the history of present complaints effectively to determine the underlying cause of fatigue. Common manifestations include rapid heart and respiratory rates, which may indicate anxiety. Functional complaints such as inability to complete work, flat affect, weight changes if associated with nutritional disorders. Dyspnea if secondary to heart or lung disease. Nursing assessment. Nursing assessment involves a number of activities. These include majorly history, objective data. You would be taken through each of these. 1. History. Obtain a comprehensive history to understand what the patient describes as fatigue. Note the specific changes that have occurred in terms of patterns of activity. Change in roles which have possibly led to increased demands upon the patient. This may originate from work, family, financial pressure, etc. Explore the pattern of sleep and rest, number of hours of sleep at night and during the day. The pattern of fatigue is also important in order to establish the cause. A normal fatigue improves with rest and worsens with increased activity. A prolonged fatigue is usually associated with psychological problem. History. Examine associated symptoms such as fever, general malaise, which may indicate an acute illness. If weight loss is experienced, nutritional disorders, hypothyroidism, or neoplasm may be suspected. Other symptoms such as dyspnea may be associated with congestive heart failure, anemia, or COPD. In order to rule out underlying disease process, associated factors should be explored. Because fatigue can be psychological, it is important to examine and identify stressors and the stress level. Other significant history that should be explored to determine the cause of fatigue include nutrition, medication, occurring as a side effect of medications such as antihypertensive, tranquilizers, hypnotics, antidepressants. Also, family history of diseases, diabetes, endocrine disorders, etc., or other situations in the family which may constitute a stressor or concern to the patient, resulting in worry, thereby placing a demand in terms of time and energy to care for the affected family member. The mnemonic COLD-SPA, which was mentioned in study session, may be helpful to extensively explore the symptom of fatigue. Objective data. After obtaining history, conduct a physical examination from head to toe in order to verify the data obtained from the patient's story. Specifically, take note of the following. 1. General appearance and overall impression of the patient. 2. Vital signs. 3. Integument scan. 4. Systemic assessments. 1. General appearance and overall impression of the patient. Try to observe the patient and the environment before interacting with the patient. This is important before the patient assumes a social phase or behavior which may becloud your assessment. This quick impression provides you a glimpse of any distress, sadness, or pain before the patient consciously or unconsciously mask it. You should observe generally the patient's level of comfort, facial expressions, affect speech, and mental acuities. If you detect any abnormalities during the general impression, then you have to perform a more detailed examination of the mental status. The assessment of mental status incorporates determining the patient's level of consciousness, noting posture and body movement, evaluating dressing, grooming and hygiene, speech, mood, feelings, and expressions. It also includes assessing the thought processes and perceptions and cognitive abilities. Weber and Kelly, 2007. For example, a tense or anxious client may elevate shoulders towards the ears, holding the entire body stiffly. Anxiety may be demonstrated by a fidgety and restless appearance. Apathy or crying may be associated with depression. The following should be noted about facial expressions. Poor eye contact may denote depression. While an expressionless, masking face is common in Parkinson's disease. On the other hand, a staring watchfulness may be associated with metabolic disorders and anxiety. 2. Integument, skin. Observe for color, turgor, lesions, and other abnormalities. A pale skin or cyanosis may indicate anemia, heart failure, or pulmonary disease. A yellow discoloration or jaundice in liver disease. Examine hair and nail. Clubbing is associated with poor oxygen status. 3. Systemic assessment. Perform assessment of the circulatory, respiratory, gastrointestinal system, neuromuscular, etc. to rule possible associations with the symptom of fatigue. 4. Vital signs. Measurement of vital signs, temperature, pulse respirations, and blood pressure is a non-invasion procedure which reflects the status of the general body systems. Tachycardia or palpitations may reflect an anxiety state or a cardiovascular pathology. Increased respiratory rate may indicate pulmonary disorder, etc. Nursing interventions to resolve fatigue. Nursing interventions in fatigue encompasses the following: physical care, monitoring medical regimen, counseling, teaching, referral. An explanation of the process and mechanism of fatigue would enhance coping. Specific interventions are determined by the type of fatigue. For example, in normal fatigue, counseling about rest and setting priorities in one's schedule may be helpful. Helping patients to plan activities of daily living in order to prevent overexertion and inadequate oxygenation may be necessary. Most importantly, an effective nurse-patient relationship, which is built on trust, is necessary in managing a patient with fatigue. Other helpful interventions include exercise, encouraging adequate sleep, techniques to reduce stress, and motivation. In pathophysiological fatigue, the underlying disease condition should be diagnosed and treated, during which time the patient's response to therapy should be monitored. You need also to prevent further impairment by working collaboratively with other members of the healthcare team. In situational fatigue, the most significant role of the nurse is to assist the patients to identify a problem-solving approach so that he or she may be able to cope with and resolve the crisis. These 3 steps are required. 1. Understand the patient's perception of the event. 2. Identify what supports are available to the patient. 3. Assess the patient's previous method of coping. Summary. In this study session, you have learnt that there are 4 types of fatigue: normal, pathophysiological, situational and psychological fatigue. Clinical manifestation of fatigue is dependent on the type of fatigue. Nursing interventions in fatigue encompasses the following: physical care, monitoring medical regime, counseling, teaching, and referral. End of study session 2. Thanks for listening.